Now for our next Echo Talk, we have Nada Fadul. You've heard of Nada Fadul this morning from Sanjeev. She will now share her version of her journey using the ECHO model in Sudan, both during the pandemic and the current conflict. Please welcome Nada.
Thank you so much. Thank you, everyone. And thank you, Dr. Aurora, for amplifying our story and for giving us this chance to tell it. So imagine a small remote community in Africa where no one is hungry and everyone has access to good health, quality education, clean water, and affordable energy. I chose a picture of women to amplify this message. These are some of the United Nations Sustainable Development Goals that our Sudan Eco Center of Excellence is working to achieve. Now, let's take a closer look at this. I'm going to take you with me on a journey to my home country, Sudan. But I want you to hold on to something because this is going to be a roller coaster ride. So Sudan is a poor country in Northeast Africa with beautiful, good-hearted people who endured a 50-year civil war that divided the country into two, a 30-year dictatorship that completely ruined the country, a decade-long genocide during which 300,000 people were killed. This all ended in 2019 with a beautiful, inspiring revolution led by women and youth. Now, Sudan emerged from all of this to face the COVID-19 pandemic with no healthcare funding nor infrastructure. Moreover, people did not trust their government and definitely did not trust the world. So rumors about the pandemic were spreading like wildfire, and so was the virus. Meanwhile, Sudan's political situation was unstable, and everything was changing daily, including COVID-19. So you can see why having an agile platform that is able to shift quickly to meet the community needs is absolutely needed. So I was watching all of this evolve as a Sudanese-American infectious disease doctor, and I could not be a bystander. I mean, this is my homeland. These are my people. So I worked together with a group of activists, and we formed a large coalition of Sudanese diaspora organizations to help Sudan get through the pandemic. With the support of the coalition, we developed a novel program, the Community Medical Response Team. The idea came to myself and a friend of mine, Dr. Reem Ahmed, who's a Sudanese-American physician at Emory University. We realized after months and months of tireless fundraising, sending supplies, installing oxygen networks in hospitals in Sudan, that was not enough. Reem and I were each managing 10 patients with COVID-19 remotely in Sudan a day, including relatives, friends of friends, but that was not enough. We were exhausted. We needed clones, like literally. So we thought about getting together a group of highly committed and trusted medical volunteers, get them to go down to the community level, raise awareness, dispel rumors, find patients with COVID-19 and help them self-isolate, and cut the chain of transmission. So we developed the protocol based on available evidence from WHO and other entities, and we presented it to the Ministry of Health. They enthusiastically approved it because any help at the community level was desperately needed. We then took the idea and ran it by other Sudanese diaspora organizations who had a lot of experience working in Sudan. And we were told right away, volunteerism does not work. They said you need to figure out a way to pay people to do this kind of work. Now, we were determined to challenge that narrative. I mean, after all, we were volunteers ourselves. So we launched a registration campaign, and a month later, we had 400 volunteers sign up, including Dr. Fatma Abu Zaid, who's here. They came from different health professions and different schools and from all over the country. Now, Reem and I were overwhelmed with joy, but also with the need to figure out a way to deliver high-quality training to these volunteers. We wanted to make sure they say the right thing and do the right thing in a very fast-changing knowledge environment. We also wanted this platform to be bidirectional and non-hierarchical, to foster trust, mutual respect, and collaboration. I mean, sounds familiar? So we chose ECHO because it met all of these needs. ECHO was also a great way to reverse the brain drain that Africa has experienced and leverage diaspora medical subject matter experts so they can give back to their country, and they were eager to do so. ECHO provided us that structured yet safe environment for us to exchange evidence-based knowledge, but also take action at the community level. So we launched Sudan's first ECHO, the Community Medical Response Team. And this is our motto that we used during each ECHO session. Together, we can. Now, a year later, we had delivered 35 sessions by 24 subject matter experts to over 2,000 attendees. Now, most impressive is what the volunteers did with this knowledge at the community level. They took this knowledge back and held 150 awareness sessions, managed 80 patients with COVID-19 in home isolation, and delivered over 20,000 doses of COVID-19 vaccination in collaboration with the Ministry of Health. I mean, that was amazing. So from there on, our Sudan Echo Center of Excellence was unleashed. We had this massive volunteer power, and we wanted to use it to focus on different sustainable development goals. So in 2022, we helped launch 5 different ECHOs. A community-oriented primary care ECHO, which is a passion of mine, a peace-building and leadership ECHO, the country needed that, a rural primary care ECHO at University of Jazeera, which Fatma had led, a peace engineering and waste management ECHO at Sudan University of Science and Technology, and a patient safety ECHO at Sudan Federal Ministry of Health. We had big dreams and big ideas for 2023. But unfortunately, a war erupted in Sudan this past April. I was devastated. I was so worried about my family, my friends, the volunteers. But we managed to get together quickly and supported each other, absorbed the shock, and we went back to the community to assess their needs. We were able to redirect our efforts from community-oriented primary care to what was needed at that time. Now, we were able to shift quickly because we already had the infrastructure in place. We had the amazing volunteers, we had the support from Project ECHO team, and the Sudan Federal Ministry of Health. Now, we are 4 months into the Sudan Emergency ECHO program. We were joined by Dr. Sean DeAndrea, who's an emergency medicine physician in Botswana, as well as the WHO Sudan and WHO EMRI teams. We have delivered over 30 sessions to over 20,000 attendees in a Telegram platform and a Zoom platform. And again, these volunteers continue to amaze us. They took this knowledge back to their community, held over 100 clinics in displacement camps in 7 states, and treated 10,000 patients who were displaced from their home. Now, thank you. They truly deserve it. So let me remind you that all of this was done by volunteers from the community and the diaspora connecting through the ECHO platform. This is a photo of our team coming back from a vaccination trip in remote areas in northern Sudan. So I'm asking you to never take no to volunteerism for an answer, and always look for the good in people. Leverage ECHO to train the future healthcare professionals to be kind, giving, and community engaged. And remember what Margaret Mead once said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Thank you so much.